All right, I'm here with John, and we're going to talk about scuba fatalities and a study he's done.
Hi, I'm Dr. John Lipman. I'm the Chairman and CEO of the Australasian Diving Safety Foundation, and before that, the Founder, Chairman and CEO of Divers Alert Network Asia Pacific. With the DAN, Divers Alert Network, I was involved in up to 1,500 diving emergencies that I helped coordinate. And I actually investigate diving fatalities. I do research into diving fatalities, and I've been involved in the analysis of 500 to 600, approaching 600 diving and snorkeling fatalities.
Can you tell us about your scuba diving study you presented today?
Today I presented a scuba diving study that looked at the diving fatalities in Australia from 2000 to 2019, and there were 180 deaths. So an average over the 20 years of 9 deaths a year.
And what were most of those deaths caused by?
Most of the deaths were probably drowning from one region or the other. So I think probably about 47% were primary drownings. About a third of them were cardiac related. Right, in older divers. The median age of the divers was about 45, of the fatality victims were about 45. And cardiac issues become a bit of an issue, more predominant in the water with older divers.
Yeah, you were telling me you're seeing more divers continuing scuba older and older, and then more older folks picking up scuba in their 60s or 70s, obviously increasing the risk. How much of the fatality is due to like equipment failure or versus like medical causes? Do we have any idea? Or
there's more medical causes than equipment. Equipment has sort of dropped away. 30 years ago, it was more of an issue because the equipment wasn't as good. Most of the time now, the equipment's better, although the people using closed-circuit rebreathers now, there's a cohort of technical divers that use rebreathers, and they require the diver to be very, very careful, essentially anal, with the management of it, the preparation and the management during the dive. And we're seeing more deaths associated with that, even in very experienced divers.
In terms of the medical ones that you're seeing, these pretty significant numbers, mostly cardiac. Do you also see epileptic deaths,
not
or
so much
diabetic deaths, or anything else, or is it mostly the heart?
It's mainly the heart. The epileptics are screened. You know, there's one that's the remaining, main contraindication to diving is epilepsy. Yeah. So you don't see much of that. You see the occasional one. Diabetes, not so much. I mean, there's management protocols that can be used for those type 1 diabetics. Cardiac is the issue because we've got an older cohort of divers, many of them being treated for hypertension and various other cardiac-related illnesses, and there's a lot of occult disease that people aren't aware of.
What do you say to the person who has known disease, they've got a little heart condition, atrial fibrillation or something, and they still want to scuba dive? How do you risk assess these folks? How do you give them good advice?
Well, they have to go to a doctor with diving medical training. That's what we thoroughly recommend, because the doctor with diving medical training knows about the precipitants of the cardiac issues during diving, and the general doctors.
What were some of those amazing numbers you gave about, like 500 mils of increased, was it blood flow?
Oh yeah, talk
to that a little bit.
As soon as a person becomes immersed, they become buoyant, so gravity's gone. And a lot of the blood that normally pools in the legs, and to a lesser extent the arms, gets centralised. So you're getting a centralised circulation. And
that's a challenge for the heart, isn't it? To get another, did you say 5 to 700
5
mils?
to 700 mils.
That's a lot.
That's a lot. So the heart has to work harder straight away.
Right.
And then when you add to that exertion of diving, they're carrying a lot of equipment in the water.
Maybe some hypoxia.
Some anxiety. Which, sending adrenaline around. You've probably got cold-induced vasoconstriction in some of the waters, or after a certain time even in warm water, so that causes more centralisation. You've got higher partial pressure of oxygen with the breathing gas that you're breathing under pressure, so that again can be a bit of a stimulant for an arrhythmia. Aspiration, and various other factors. So it's a witch's brew of potential for cardiac arrhythmias.
And yet we do market it, like you were saying in the talk, as something everyone can do. And you see all these sort of extreme sports and everything now. You know, scuba is something that is thought of as very benign, and it's an adventurous sport that anyone can do. But in reality,
it's not.
There's some that die from it.
Yeah. And the key is to be aware of the risks. So, you know, a doctor assessing a diver, a prospective or an active diver, has to take a medical assessment of them, explain the risks to that person, their individual risks, and then it's a risk acceptance equation. You know, as the doctor doesn't say, you can't dive. Yeah. The doctor says, look, this is what I think, this is your risk assessment, you make your assessment.
Yeah. Well, thank you. It's been a good 5 minutes.
Pleasure.
We'll continue this in a second with the snorkeling talk.
Yep, sure.
Right, thank you.